New South Wales, where I live, we're lucky. It's a Premier's priority. It's the whole of government. We've got funds available, and with that we have new clinical services and prevention. This is to reduce childhood obesity, but we have to give regular process. So this is one that the government every month sends to everybody, and you see how you're going against everybody else. This is, 7 local health districts have a plan, 6 have a steering group. This is the Get Healthy service and so on, the use. And we've actually, in all our hospitals, there is now no soft drinks, it's only water available. And from the middle of this year, what's provided in the canteens has to meet rigorous standards, and there should be no. So we've removed soft drinks, we've improved food choice, and people are very happy. They don't mind. It's what we should be doing. And again, we get a report. See, we're all pretty good at getting rid of the soft drinks, except this poor health district. So what are we doing in my hospital and health districts? We're actually weighing patients, especially children. We had 1,407 children turn up to the emergency department at Royal Prince Alfred Hospital in 2017. How many of them had a weight recorded? 7. It might have been on scraps of paper, but we're now doing it. We have we have these government-funded programs, Go for Fun and Crunch and Sip, and we're setting up a whole lot of new clinics to help, particularly at that childhood and young adulthood. So how do we manage obesity, and why treat it? To prevent disease and premature death, to reduce complications, and to improve quality of life. And the last thing I've put there is weight loss, because I think we've got to start thinking like that. If it's a disease, that's what we're doing. Now, there are medical programs, and you need to choose the interventions for the patient's needs. And you need to stratify the treatment depending on the BMI and complications. So what somebody with a BMI of 28 is not what someone with a BMI of 75 needs. And there's a whole range of things. There's eating. I try not to talk about diets. Why? I asked people about this yesterday. Why shouldn't you talk about a diet? Because a diet ends. You go on a diet for something. I'm going on a diet to fit into the wedding dress. I'm going in a diet because it's summer. I'm going on a diet to be able to do something, And once you think you're able, stop. But we're eating for life. Activity, behaviour and habit, medical treatment, and then I put adjunctive treatment, which is obesity pharmacotherapy, meal replacements, and I'm not talking about devices and bariatric surgery. But the important thing in all these programs is follow up. Now, we have the Get Healthy line. So this is a government-funded line, and anyone can ring it, and you can be referred by, GPs are meant to say, oh, shouldn't you like to use the Get Healthy line? We have Get Healthy in pregnancy, Get Healthy for children, right? Get Healthy for diabetes. And this gives you 10 individual on the phone consults, up to an hour of them, and you can choose the time, and it's tailored for you. And we now have about 250,000 people who are going through this, and in 6 months they lose 4 kilos and their waist comes down. And this continues, and the idea is we're not worried about it long term, we're just worried that people will keep coming back and using it again and again, because that's what we want. And if we send people to Weight Watchers, the Australian Weight Watchers do very well. If you send them to the GP, they don't do quite so well. And that's the same in Germany and the UK. So people like me and other people in the audience who might need it, Weight Watchers is a good way of doing it. However, our BMIs are in the 20s rather than in the 30s, 40s or 50s, where we would need a different approach.